So I'm going to try and finish on treatments. I'm going to try and give an overview, though. If you have some possible treatments, you can find them by accident, you can guess, you can use analogy with other diseases, or you could rationally design them. Well, clearly, rational design means you have to understand the disease process. And because we do understand it, there have been inroads into rational design. First of all, PRPC is clearly necessary. So if in some way you could reduce PRPC, that might help. And there are various methods, some of which you may hear about today, whereby people have tried to affect PRPC so it's depleted or not allowed to convert. You might try to prevent the interaction process that converts it to the abnormal form. You might try to remove PRPSC. And you might try to stop the neurons malfunctioning and dying. And all of these have been the subject of people's interest in developing treatments. The vital importance underlying all of this is understanding protein structures and understanding the causes of neuronal death. Those seem to me to be the key elements. Well, of course, if you have possible treatments, you have to assess them for efficacy and toxicity. And basically, human trials are obviously the real test. As a clinician, that's what I'm interested in. But, of course, it's usual to do some kind of test before that. You could do chemical tests, seeing how chemicals interact with each other, and that's useful, but it's not occurring in a biological setting. You could use cell cultures, and that is biology, but they're very simple. They're not whole animals. You could use animals, but the trouble is, most of them, as you're not surprised to hear, are not human. And the question is that relevant? So there are always objections to these methods. One of the interesting things to me is the development of organoids, or some people call mini brains, which use human cells to create small brain-like structures. Although that's not a whole animal, at least it does allow some kind of study of disease and treatment in human organized neural tissue. So I think that's a very interesting development. Some comments on treatment. The earlier the treatment, the better the outcome. This is true for almost anything, including appendicitis. Early treatment, though, requires early diagnosis. And the trouble is that symptoms may well begin sometime after the disease process starts. Is it possible to diagnose early enough? And I think this has been a problem that people have understood, for example, with Alzheimer's disease. By the time you're treating Alzheimer's disease, I think it's probably too late. You need to do it 10, 20, 30 years before. Of course, the earliest form of treatment is prevention, and that is really quite promising. And so I think, for example, gene mutation carriers who are well really form the best and most hopeful group, in my view, for developing treatments. The final comment about this is that if you're going to do treatment trials in these diseases, you do need international collaboration and you do need good human trial design. And I think there is good international collaboration, and I think we've learned a lot about human treatment trial design over the last few years.